And a very good morning too. It is that time of the month when we are joined in the studios with our resident medico, Dr. Clara Chu. Hey, how you doing, Clara?
Yeah, doing really well. Thanks, Mick.
That's the way. Now look, another big health topic this morning, and this one, people have probably heard about this one, and they may have used it at some point, but I think a lot of people are still to kind of access this one. And we're going to talk today about allied health professionals. So Allied Health Professions Day, it's coming up on the 14th of this month. So can you tell us what is an allied health professional?
Yeah, so an allied health professional is a health professional who's not a part of the medical, dental or nursing professions. And they are university qualified and they have specialised expertise in preventing, diagnosing and treating a range of conditions and illnesses. And so they often work within a multidisciplinary health team to provide specialised supports for different patient needs.
Cool. So what are some of the main disciplines of allied health?
Yeah, the most common ones that our listeners may have seen or heard of are physios, so physiotherapists, occupational therapists or OTs for short, speech therapists or speech pathologists, exercise physiologists, dietitians, psychologists, pharmacists, social workers, podiatrists, audiologists, chiropractors and osteopaths.
That's quite the list, isn't it?
That's quite a comprehensive list, yes.
Yeah,
There's a lot of them.
Yeah, you're not really missing anything there, that's for sure. Now, what roles do allied health professionals play in the medical community?
So they play a vital role in the medical community. So, a lot of the times we think that it's just doctors and nurses, but really they complement the work that doctors and nurses do to provide comprehensive patient care. They have a number of key roles. The first is that they help us with assessment and diagnosis. So many allied health professionals, such as physios and OTs and speech pathologists, actually do assessments for patient conditions and they help us to develop treatment plans for them. The second is rehabilitation. So, I'm sure a lot of your listeners would have either been in surgery or had an injury of some sort. And so, yeah, they're very important in the rehab process, helping patients to recover from injuries and surgeries and other chronic health conditions as well. And then the third is patient education. So, doctors, as you're probably aware, often GPs only have like 15-minute appointments,
Sure.
Limited time for patient education. So, they're able to spend more time with patients, educate them about their health conditions, treatment options, and this empowers them to manage their health conditions more effectively. And then the fourth thing is that they also look after the area of preventative care. So many allied health roles, such as like dietitians and diabetic educators and those kind of people, they'll focus on prevention, helping patients to adopt a healthier lifestyle and to reduce either the risk of developing the disease or the risk of the disease progressing. So overall, they've got a diversity of skills and expertise that allows them to help us improve patient care and outcomes across both, public, private, inpatient, outpatient settings.
So how are they used by doctors?
We often refer patients to allied health professionals for specialised assessments and treatments, and we rely on their expertise to manage certain health issues. In many healthcare settings, allied health professionals will work as a part of a team alongside doctors and nurses, and they will contribute towards a comprehensive care approach for complex medical cases. So, a good example on the coast would be the geriatric team at Gosford or Wyong Hospital, where the medical team will work very closely alongside the physio, the OT, the speech therapist, the social worker to help the family come up with the best ongoing care in the community for their patients. And then allied health professionals will also assist doctors in gathering essential patient data through tests and evaluation to help us make an informed decision about the diagnosis and treatment plans, because obviously we don't have all the expertise and all the skills to make certain diagnoses. And they help us to implement treatment plans and support patient recovery. So, very commonly is post-op or post-injury, seeing a physio for that. And then finally, they provide education on lifestyle changes and rehab exercises, and that allows us to focus on medical treatment while ensuring that the whole of them is being looked after.
Yeah, so we've sort of had a bit of a look at how the doctors use them. So what about the patients themselves? How do they use allied health professionals?
Yeah, so the patients can directly interact with allied health professionals allied health professionals for specific services. So, for example, they can go and see a dietitian for nutritional guidance or seek physical therapy from a physio. They often also play the role of a coach or motivator to help patients stick to a treatment plan or to manage certain chronic health conditions or to help them get to their health goals. They can also provide tailored interventions based on individual patient needs. So that can enhance the effectiveness of treatment and help improve the patient's satisfaction as to, how their health is going. And patients can then also benefit from the knowledge and the resources that an allied health professional can offer. So that allows them to make more informed decisions around their health. And finally, following surgeries or injuries, patients do rely on allied health professionals for rehab to help them regain their function and regain their independence.
Yeah, we are talking with our resident medico, Dr. Clara from Life Medical Centre this morning, and we are chatting about allied health professionals. We'll take a quick break and we'll be back right after this. Welcome back. This is Rhema Brekky. We've got our resident medico, Dr. Clara in this morning from Life Medical Centre. We are chatting about allied health professionals, a very, very important subject, this one. Now, Clara, who are they most suited for?
So they are most suited for a wide range of individuals and situations. So I'll go through some of them. So, our patients with chronic conditions like diabetes, heart disease, osteoarthritis, osteoporosis. So, they're all excellent candidates for getting help from an allied health professional. Patients with rehab needs. We talked about rehab a couple of times now. So, recovering from surgeries, injuries or strokes. People who are facing mental health challenges can find valuable assistance from psychologists, counsellors, social workers to just help them develop, coping strategies and, processing skills. Children with developmental delay, learning disability, autism spectrum, ADHD, they can all benefit from seeing various therapists to help improve their ability to gain independence, to improve their function at school and at home, to make life a bit easier. The elderly can definitely make use of the services, especially physios, OTs, dietitians, exercise physiologists to just manage age-related health issues and maintain a quality of life. And then, of course, there's those who are looking to improve their health and prevent illness. So they can be people who are perfectly well, don't have any particular health issues, but, to optimize their health or to, improve their current situation, they can get help from health educators and dietitians to focus on lifestyle changes and things like that. Athletes is another group, so they often work with sports medicine specialists, physios, exercise physiologists, sports dietitians, obviously to enhance their performance and recover from injuries. When you get to the really elite level, you'll find that there's often like sports psychologists and those kind of people involved as well. Yeah,
there's a lot goes into it. You need a good team of people for the elite athlete.
Yeah, absolutely. And then, finally, anyone who just wants some guidance on like nutrition, exercise, lifestyle changes can often find help from various allied health professionals.
Yeah, now you work over at Life Medical Centre there at Erina, and a big g'day to everybody over that way. Wonderful group of people. So can you talk to us this morning about some of the allied health professions that work alongside you guys as doctors?
Yeah, sure. I'd love to. So at Life Medical Centre, we work under the model of a multidisciplinary team. So that means we have various allied health professionals at our practice, and we work together as a team to look after our patients. So in no particular order, we have a dietitian who helps our patients improve their gut health, provide nutritional support, help them work out what may be causing their gut symptoms. And we have an exercise physiologist to make sure that our patients are moving regularly, that they're exercising at a capacity that is suited to their physical ability. She would also take into account any pre-existing pains or injuries or any medical conditions that may need special attention, such as osteoporosis, osteoarthritis. We're a little bit different to the most in that we have a life coach. So a life coach is someone who specializes in helping our patients adjust their mindset and self-perception. So we find that that's been really important and valuable for helping them get a better handle on how they can make lifestyle changes that would improve their health outcomes. She's also a breathwork coach, and she's been running some workshops on breathing this year. And so, we also, of course, have a good working relationship with other allied health professionals on the coast, just because they're not a part of our practice. We send our patients out to various psychologists, to exercise physiologists, other than the ones that we have here, if there's, limited availability, physios and those kind of people, just to name a few.
Yeah, look, I love the fact that you guys have got a life coach over there, because oftentimes, people will get themselves into a routine of living a certain way, and, you can throw all the medical knowledge at it, you can throw all the medicines, the interventions and things, but if they don't change their mindset and they keep getting stuck in their old ways, then they never really get anywhere, do they? So, addressing that, I think, is just such a huge thing. And, I hope, for one, that it catches on more and more.
Yeah.
In more medical practices. That would be absolutely amazing. Now, moving on this morning, what disciplines, I guess this is probably the one we should be asking, what are the most frequently used?
That is such a good question. I would have to say that given our current social environment and the increase in mental health presentations to general practice, probably psychologists would be the most frequently utilised.
Yep.
I think this would be followed, closely by our physios and our dietitians.
Yeah. And do you guys see, a real link between, mental health conditions and food-related issues as well? There's a bit of literature about that at the moment, isn't there? Yeah,
there is. So, there are also, psychologists who specialise in eating disorders. Yep. And when we're talking about eating disorders, we're not just talking about sort of under eating, we're also talking about overeating or anything that's got, a difficulty with the relationship with food.
Yeah.
That can also be addressed through specialised psychologists.
Cool. Now, probably some listeners this morning thinking, I probably need to go and maybe see one or two of these allied health professionals. So how can people arrange to go see an AHP?
Yep. So for pretty much all of the allied health professionals, people are able to self-refer. However, for those with a chronic medical condition who has at least 2 specialists or 2 allied health professionals looking after them, so it could be any combination, they may qualify for a care plan with their GP. This would then give them a 5 Medicare subsidised visit per calendar year with the allied health professionals of their choice. So now, obviously, everyone needs to speak to their GP as to their eligibility. Not all chronic conditions are eligible, but the majority are.
Yep.
So there's a few kind of like fine print there. I should also mention that GP mental health care plans, which allow patients to see a psychologist for up to 10 Medicare subsidised visits in the year, are also available. So again, I would encourage our listeners to speak to their GP if they think that that is a service that they would like to have access to. And then aside from Medicare, we should remember that private health insurance does offer rebates for most of these allied health visits. Again, the fine print would be, does my health insurance plan cover it? Does my particular health insurance plan cover a certain allied health professional?
Yeah. Now, obviously, again, you've rocked up to the doctors and you're about to meet the allied health professional team. What kind of things can patients typically expect during a consultation?
Look, this would vary from discipline to discipline, but generally a patient would be assessed as to why they're there, what they expect this particular person to be able to help them with. There would then be a discussion about the history around the issue, what their symptoms are. For some specialties, you would get a physical examination. Obviously, for a dietitian, probably not as much. And then the patients tend to be given a plan of something that they can work on or try until their next consultation. And certainly for some, some specialties, there might be tests that you have to do. So, for example, if you've injured your shoulder and the physio is not 100% sure whether there's something more serious underlying, they might send you back to the doctor and go and get some scans done.
Sure.
Or for a dietitian, there could be sort of like gut microbiome testing, or, other types of blood tests and things like that to look for, deficiencies and that sort of thing.
Yeah. So when would the best time to see an AHP?
Look, the most obvious one is when you are referred to someone by a
Sure.
doctor, either your GP or your specialist. So, if they're recommending that you go see one, I
Just
think,
do it.
yeah, just do it. I reckon that's a good idea. Otherwise, you can self-refer. So, not all things need to go through a doctor first. So, if you have a question about a particular aspect of your health, or you think that a certain allied health professional would be able to help you. So, self-referring to a dietitian for a gut issue is fairly common.
Yep.
Self-referring to a physiotherapy for like a sporting injury or something like that, also fairly common. And so, there's all different things there where you can, do a bit of self-referring. So, yeah, I guess, it's when patients kind of feel that they would like some help in a particular area around their health that, seeing these particular specialists can, really enhance what's going on for them.
Yeah, absolutely. As our resident medico, Dr. Clara Chu there from Life Medical Centre, talking this morning about allied health professionals. It is, and of course, Allied Health Professions Day coming up very soon this month. And it's a big topic and a very, very important one too to help you on your health journey. This is Rhema Brekky.